Let's go to PNG now. We touched on this last week. It had a lot of focus last week. Understandably, you know, with all the scandals around this week, it hasn't been front of mind, but this is a full-blown crisis there.
It is, Kieran. I think it's very important we continue to raise this issue. We have a rapidly developing emergency to our north, with COVID outbreaks and the hospitals under strain in PNG. The Prime Minister Scott Morrison last week announced he was sending 8,000 doses of vaccine to the troubled country for healthcare workers, and he wrote to the EU asking them to free up 1 million vaccines Australia has ordered to send to the COVID-hit country, and has yet to receive a reply on that, I'm told. Given that the production of AstraZeneca vaccines has begun domestically today and we are producing 800,000 vaccines a week, is it time to simply divert a week's supply of the Australian domestically produced vaccine to the country? In that team the government sent up there to assist the ailing PNG healthcare system, we have sent just 3 medicos. But it is starting to become clear some more drastic assistance is needed. Here is the PM last week being asked if we will have to divert domestically produced vaccines.
If the Europeans don't come to the party with your request to send us the vaccines for which we've paid for, would you be prepared to divert some of the domestic production to PNG? And how would you respond into there will be inevitable criticisms about giving vaccines to foreigners ahead of Australians that will come from...
Well, twofold. Look, I expect to and would hope to get the cooperation out of Europe for this. We've all said that we need to get vaccines where they're needed. This is not Australia seeking to do this for our own direct benefit, although we've contracted them. You would expect them to be supplied otherwise. But we're not factoring those into those additional international supplies into the vaccination program that Professor Murphy and I outlined to you on Sunday. So this would enable us to direct those supplies into Papua New Guinea and indeed into other parts of the Pacific if needed. Those vaccines and their deployment would therefore, I think, be following through on the very public statements that have been made in the European Union about their commitment to ensure that there's no vaccine protectionism and that vaccines do go to those most in need, and that's why we're putting that forward. And on the question of diverting from Australian supplies, well, those supplies obviously wouldn't be, but we have already, as I outlined on Sunday, indicated that we would be doing that. There was a supply of our own produced vaccines that we're already factoring into the distribution in the weeks ahead, and that will continue. And I don't think Australians have a problem with that.
I'm sure he actually ever directly answers that, but I think we will have to send domestic vaccines at some point if the EU doesn't play ball. Labor frontbencher Bill Shorten has received an email that SOS International, which runs a hospital for expats in PNG, has issued in an order to evacuate all non-essential staff. It spells out the dire situation ahead. I'm going to show you this advice from the company to its workers. It says the country's healthcare system will face increased pressure as the outbreak continues to accelerate. Healthcare facilities may be unable to manage treatable conditions as usual. This includes medically urgent conditions and emergencies such as malaria, heart conditions. Then it talks of a 4-week isolation strategy being implemented by the government of PNG, and then it says the stability of the overall security environment will depend on whether the national isolation strategy period will produce a reduction in transmission of COVID-19. We expect the authorities to extend that past a month. And then it says if the national isolation strategy fails to improve COVID-19 transmission, anti-government sentiment will increase. There'll be street protests that could turn violent. The authorities may be consumed by trying to enforce COVID-19 related measures and will likely be unable to contain the unrest and an increase in opportunistic crime. So big warnings there, Kieran, about the situation. Now, the Australian government, they've told me there's another 50 medicos being vaccinated and on the way. But I just think over the next month, we're going to have to see a much more substantial commitment to PNG, remembering again the proximity of that country also to the Torres Strait Islands.
Yeah, 5 Ks at its closest point. It is a stone's throw, literally.